All right, now we are live. Hey, good morning, everybody. Friday, February the 7th, 2025. Man, I got some exciting stuff to share with you guys. So we're going to wait. We're not going to wait. We're just going to continue. We're just going to start. Just finished a ARD for my kid. I'm in the vehicle waiting for my wife to finish off. But we're going to be talking today social media. Okay, social media and what I think agents need to be doing, as well as how to utilize AI. Man, I have never had such a tool that can help me process my ideas and something that I can run against. I have nobody to go to. Hey, I want to do this. How should I do? I've got nobody to go to, so I've started utilizing AI to help me with. So let's get into social media marketing, guys. There are a lot of changes with social media right now. Okay, a lot of rules. I don't understand them all, but here is what I have found: advertising on social media. Advertising on Facebook, especially, what I have seen is that it's getting tougher. Okay. New rules, especially in the category for insurance, from what I understand, is we can no longer target areas. We got to go national, I guess. Kind of stupid. They're calling it discrimination. I don't know why we can't, but it is what it is. But what I'm hearing from agents across the board is that social media is not working as well as it used to. Lead costs are up. Um, the people are getting leads. The problem is that they're having a hard time getting a hold of insureds. I'm seeing a lot of that happening. So, what can we do? I wish I had the answer. If I had the answer, guess what? I'd probably be doing it and then testing it. But I will tell you, yesterday I was at a seminar. I was at a Cody Askin seminar here locally, and it's good. I've been in the business 25 years, and I think I've pretty much have heard it all. I thought the seminar was good. They had great speakers, a lot of high motivational type of stuff. Yeah, okay, fine. But there was one thing that I got out of this, and there was just one. Okay, but I left kind of towards the end. I had to go pick up the kids. But I would tell you this one thing that I learned was, if you're going to advertise on social media, and he was talking some crazy, crazy numbers out there. Okay, so many billion people. They're thinking a new 1 billion people will be on social media. Now, these are worldwide numbers, but social media is still out there. And the one thing that got my attention was this: we've got 3 seconds. Just literally the attention span of the average person on social media, who he said was on social media at least 2 hours a day. We've got 3 seconds to capture their attention before they move from your ad. 3 seconds, guys. 3 seconds. So you could have this beautiful ad, but if you don't capture them in the first 3 seconds, you're done. So I started thinking, and I would love for you guys to see here. I don't have, hey, Reagan, what's going on, bud? Good to see you here, man. Here's one thing I would like for you all to put on the chat for me. Tell me, what part of the ad do you think is where the first 3 seconds is? Okay, let's see here. I may not even be asking the question the right way because none of you guys maybe would answer, but give me an idea. What part? And I will say it's 2 words: the blank. It is the blank of an ad. Let's see here. Help me out here. And I'm going to show you guys what I think you need to be doing and how to utilize AI to help you with this, because I did it yesterday. All right. Anybody? Visual? The visual? Yes, the visual. But before they get to your visual, the visual captures your attention. But the wording, what is the wording? Okay, I'm going to put it on here. And I'm probably not asking the question the right way. It is called the hook. Okay, you got to have a powerful hook. Otherwise, in those next 3 seconds, they're on to something else. Okay, so this is what I did yesterday. Okay, I'm going to share my little screen. Where did it go here? All right, come on. Okay, let's see here. Trying to make sure I do this right. Present. Share screen. Yes, allow. All right, here we go. Okay, so guys, you should be seeing the AI tool that I like to use, and it's called Chat GPT. Now, I know China came out with the DeepSeek, the brand new one. I read a really good article about that, and what they're saying is that it's a Chinese product. Try asking it something political about China, and it's going to get censored because it's monitored by their government. So they were like, ask about the Tiananmen Square, ask about, whatever that has to do with that, and you're not going to get any answers. Okay, so Chat GPT is, I think, truly still the elephant in the room. All right, so check out the comment I'm going to put on here. Okay, I do the paid version. It's a whopping $20 a month. Okay, it's cheap. All right, so I have an app on my phone. I've got a extension on my Chrome. But look what I'm going to type in here, guys. I need to run an ad on Facebook, YouTube, and TikTok, assuming it's still around. Okay, TikTok and Instagram. Okay. I need a good hook to sell health insurance. Can you give me examples of attention grabbing hooks? Boom. Okay. It goes to work. It's like you got a buddy to go talk to. And there's no other buddy that you have that is as smart as Chat GPT. All right. So we got 3 seconds to capture somebody's attention. So what if you could protect your health and your wallet at the same time? Let's make it happen. Don't wait for an emergency to realize you need health insurance. Get covered today. Is your health insurance plan really covering the way it should? Let's find out. Affordable health insurance is possible. We'll show you how. Those are attention grabbing hooks. What about for YouTube? Struggling with high medical bills. Watch this before it's too late. Why wait for a medical emergency? Anyway, I'm not going to read all these, guys. What if health insurance was easier than you think? On TikTok, the secret of affordable health insurance. The one thing that could change how you look at health insurance. Instagram. So now you've got a list of hooks here. All right. Now, I went a little further with my little buddy here that I can run ideas on. Okay, give me a minute here. Okay, then I asked it, how about attention grabbing hooks for Medicare? I want to capture seniors' attention and help them with their Medicare insurance options. Okay, boom. Now it goes to work. Remember, that was health insurance. Now I'm just creating some hooks for seniors. Is your Medicare plan really giving you everything you need? Let's find out together. Feeling overwhelmed by your Medicare choices? Let's simplify the process. Get the coverage you deserve. Learn how to make your Medicare work better for you. your health is priceless. And make sure your Medicare plan covers it all. There's some YouTube hooks. There's some TikTok hooks. There are some Instagram hooks. All right, now let's take Chat GPT further. Man, because this buddy, he doesn't care how much you push him. All right. Then I went on here. Remember, I'm looking at my phone. I did it on my phone. Okay. Now, check this out. I need some urgency and call to action hooks. Open enrollment in soon. Time is running out. Last chance to switch your plans. Hurry, you're missing out on benefits. Okay, boom. Okay, so it's just giving you ideas. Now, here's what I asked it. Help me create some ad copies for health insurance and for Medicare for seniors. I need ideas for static images as well as video. Use the attention grabbing hooks that we just talked about. Boom. Oh, damn. I did. It's stopping me here because I got to log in. Come on. Give me a minute here. Let me log in. So here's what happens, guys, when you don't use, great. See what's happening. So if you use the free version, after you tap into it a couple of times, you tap out on what it's going to, how much it's going to help you out. Oh, come on. Okay. I was doing it and I wasn't signed in. Oh, here we go. Okay, let's go back. Oh, that's yesterday. Oh, where's today? Come on. Oh, okay. I lost what I was just doing. Okay. All right. So let's continue with this thing. All right. So let's go on here. Oh, man, this thing was working beautifully till I hit the wall right there. It's like, really? Okay, going back on here. Okay. So I think I put on here, help me create some ad copies for health insurance as well as Medicare. Use the hooks that we just talked about. Okay, let's see what it does. Boom. It gives you all the stuff to go make your own ads. Guys, you just got to give it context. Okay. That's the one thing I learned about Chat GTP is that you have to give it context. Otherwise, it doesn't know how to go to work for you. Okay. So here's a short, punchy one. $0 health insurance, you could qualify. If you make 40K, you might qualify for free or super low health plan. Covers doctor's prescriptions and more. Okay, stop overpaying. Don't risk high medical bills. Here's some Medicare ones. Seniors, are you missing out on extra Medicare benefits? Seniors get more from your plan. All right, give me ideas on ad copies. Okay. So like now I want to create a picture. Okay, an ad copy is the picture. So let's see if it gives me like, hey, what kind of picture could I use here? Okay, so it's not telling me. Okay, well, let's just go back to work. Give me ideas for static images for the ads above. Oh, it's still working here. Okay, so you see it's still working, and that's why it didn't take that. All right, I'm going to be driving now, but I'm not driving, guys. And hopefully I don't lose y'all. But that's what my whole topic was today, is talking about ad hooks. So it's still going to work. But when I had done this the first time, there was a little deal that said, here, get a picture of a family. Let's see if it'll do it now. Come on. Okay, here we go. Give me some ideas. So, oh, there we go. Image idea. Perfect. That's what I was looking for. Get a picture of a smiling family, mom, dad, and kids, with a text overlay. Health insurance for $0 per month. The call to action button. This is a little button they're going to click on. Check now. Find out in 60 seconds. An alternative image. A side-by-side comparing of a $0 premium versus a $500 hospital bill. Okay, here's another image idea. A shocked person looking at a medical bill. I mean, again, guys, I'm not that creative. So, but now I know, stop overpaying. Maybe I could go find a picture. Okay, now ChatGTP has some other tools here. So sometimes the picture that ChatGPT creates sucks. All right. But I think Dolly is help create some images. So let's get this idea. Okay. So I'm going to copy this. Control C. I'm going to go to Dolly. Dolly, turn your imagination into imagery. Help me make a image for Facebook, for a Facebook ad for health insurance. This is what I want on the picture or image. Boom. Let's see here. It's going to work. It's making my image. Let's see how good or bad it looks. And there's other GPTs, guys, that you can go to Explore, and you can see other stuff that's there. And I wish I knew what GTP stands for. Okay, while that's creating, I'm going to hit some questions. Cassandra, is it being recorded? Yes, Cassandra, it's being recorded. This YouTube Live will be recorded, so you've got to go to my channel. And then under my channel, you can look at videos, you can look at shorts, and you can also look at live. So it'll be there. So yes, most definitely, Cassandra. All right, check it out. Now the first one, the image is not too bad, but look at this one. This one looks pretty good. Yeah, it's AI creating it. Maybe you tell it, hey, make or give me a different image. Okay, maybe you don't like this guy. Okay, you just talk to it. So again, this Chat GTP or GPT is a great little buddy for you guys to have and run ideas up against. All right, let's see what kind of image it gets. And then while I'm waiting here, guys, give me some comments, questions, guys, because this is all I got for you today. It's all about marketing. Remember, yesterday's meeting, the one thing I got out of it, other than the motivational stuff, is you got 3 seconds to capture them. Okay, that is your hook. Ooh, I don't like this one because look, 2 commas, it doesn't look too good. But you know what I did hear in marketing, sometimes errors in the ad capture somebody's attention. Okay, maybe they're intentional errors. But if you want to be like right on, look at this one. This one actually looks pretty darn good. Now you can download it, and now you have an image. Or you can go to a stock, like Adobe stock images, or there's a whole bunch of other stock images. Let me see here. Stock images. Oh, there we go. iStock. No, Shutterstock. That's pretty popular. Um, well, I just did a search. It truly did suck. Let me go to Adobe stock and Control V, a shocked person. Let me see here. No, it doesn't give me. Anyway, you may have to do some more work, but ultimately, I kind of like this. Use this image. You don't have to create. Oh, I just gotta put my seatbelt on. You don't have to create a. Um, you don't have to create an ad. This could just be a post. Okay, a post doesn't cost you anything, but if you do an ad, a sponsored ad, you're going to be spending some money on that ad, but you get to control the ad spend. So you tell Facebook, I want to spend this amount per day. And then if you capture somebody's attention here, what is it that you want? If it's just a post, maybe you're looking for likes, and then you can DM every person that liked your picture. Maybe you're looking for comments. You never know, but it doesn't cost you anything. So, you could do this every single day. Go create a post with one of these attention grabbing hooks and see what it does for you. And it doesn't cost you anything other than a few minutes of work. So go get Chat GPT. You can go use DeepSeek, whatever. There's Microsoft Copilot. There is Gemini by Google. They're all the same, I think. I don't know. Just figure out one that you want. ChatGTP seems to be like the beast. So consider that. Okay, any questions, guys? I don't see any comments on here, but that's all that I got for you today. A couple of things that I want to share with you agents out there. If you're out in an island all by yourself, and I hear this all the time from agents, guys, I contracted with an organization. They provide hardly no training and no support. Okay, what can I do? Well, number one, we're getting close to the blackout windows ending. So if you want to transfer your contracts over to an agency that will support you, you're able to do that. Am I accepting contracts? Yes. If you want to come with us, because I do provide training and support. Okay. So all of my agents, and I just started it this week. I have a 5 to 6 week training program for ACA. I have an 9 week training program for Medicare. Okay. As my agents, you get the training for free. And then I add you to school, which is my training and support platform. Now, if you're not my agent and you want to stay where you're at, that's fine. I'm going to share with you guys an opportunity. Okay. I open up my training to people who join the ACA and Medicare community. And I will share this link here. Give me 1 minute. So if you want to stay where you're at, 100%, hey, no problem. Here is the link to sign up. Okay. It's a small group right now, and we're doing a lot of stuff for you guys out here in the community. Come join us. It's $50 a month. If you join my community, then you get my training. Okay. I invite you, I share the Zoom link to the people in my community to come join our training. Now you may think, well, I already missed class 1. I'm going to keep doing these classes all year long. I recycle. But class 1 with ACA was all about the setup, the right contracts, the right certifications, softwares that you need. And I do them on Wednesday mornings. Thursday, I do Medicare training. And I did the very same thing. Hey, the contracting, certifications, stuff that you need to do to get ready. I haven't dove yet into the actual training, but I will next week. So not too late. If you want to come join us here at the community, come and join us, guys, because I am giving you guys all of the training that I give my agents that are contracted directly underneath me. It's $50 a month, guys. and it's just not the training that you're going to get. Okay, there's a lot of other stuff that happens on there. We have agents asking us for quotes. Hey, I have this scenario. How would you quote it? So we're gladly help you guys with that. The other is we give you discounts on all of our products that we offer. My ACA, my Medicare Smart Books. We also are bringing in lots of experts, financial, tax, business, carrier reps to come talk about their products. We really want this to be a good group for you guys so that you can grow it. All right. Hopefully you decide to join. Other than that, guys, I'm good to go. I don't see any other comments on here. Hold on here. Reagan, hey, man, I hope this helped you out. Maybe you can create some ads. How was your ACA OEP, man? Did you kill it? We did really good, man. We did about 1,800 new heads this year. We did really, really good. David, yeah, no, dude, I'm driving, man. I had this thing on autopilot. Okay. Put the blinker to the right. Turn right. There's my autopilot driver. Yeah, she's driving there. She's on the wheel. All right, let's see here. From Anthony, thanks for the info. Another good source to help agents hang in there, Luis. Hey, man, I am. Thank you, Tony. Good talking to you, bro. Appreciate the comments. Appreciate you being on here. Guys, we're really trying to do a lot of stuff for you guys. Come join us, guys. We'd love to have you on the community. And don't forget, guys, the smart books, the ACA smart books, they're huge, guys. All right. Come and get these smart books. That's where you go get them. And you're like, what is a smart book, Luis? So I had a manual. I had a binder with all my stuff in it. Because remember, I've never had anybody to go to. Okay. If I was out in the field talking to a client, I'm like, how do I figure this out? I had to figure it out. All right. So a lot of wasted time. So I have a lot of important stuff in each of these smart books, and they're in English and Spanish. So, and for example, on the ACA, I have the federal poverty level. I have immigration stuff in there. I have income stuff. I have household stuff in there. I have stuff about the dental, the vision, the indemnity plans at your fingertips, guys. And I update it every year. So all you've got to do is open up your smart book. If you have a physical version of it, which you take my PDF and just go to Office Max and just go print a copy. It costs you $20 and buy the binder. Or you can just keep it as a PDF on your computer, put it into Google Drive, and then open up on your iPad, whatever. On the Medicare side, I've got the presentation that you can utilize to make sure that you're doing a Medicare 101 educational type of deal. So I know I had one agent that took the first 20 pages of that 70-page smart book, and he created giveaways with that for his clients when he ran seminars, because it literally will just educate a senior on Medicare 101. So they know what Part B, Part A, Part B. They know their options, which is going to be a Med Sub, PDP, or an MA plan. They know what Medicare covers and why they need to select either option A or option B. It's really, really educational for them, and it sets you apart. I have it on there for you. Okay. So consider going to this website. Okay. And buying the book. And it's a one-time purchase, guys. You buy it one time, and every year you will get an email saying, hey, I've just updated it with the latest numbers. All right. So hope you guys find that helpful. Guys, I got to roll. I'm on the road. I've got an appointment here coming right up that we're driving to. You all have a wonderful Friday. See you guys next week.